cancer warrior, battling the disease, putting up a good fight. This is the kind of language commonly used to convey goodwill to cancer patients. However, Irish author Marion Keyes called out the terminology this week, saying it put a heavy burden on people who are already very sick and very scared. Vicky Phelan joins us. Vicky, do you agree with Marion Keyes?
I do, Shane, yeah. I suppose the way I look at cancer and one of the kind of ways I cope with living with cancer is I treat it like a chronic illness like diabetes or, another illness that people live with for a long time because, I've outlived my prognosis at this stage and I'm, 2.5 years into a terminal prognosis, which, nobody expected, me included, to be honest. But I think, I balked, I think, at the time, and I know people mean well, and people say, oh, you'll beat this and you're going to do it. And people mean well, Shane, but at the same time, it puts a huge amount of pressure because just because somebody dies from cancer, maybe after 6 months or a year or however long, it doesn't mean that they didn't fight as well as somebody else, and I really don't think it's fair on the person that's living with the cancer or on the family that's left behind. It's kind of like, and I know I've had this conversation with people, they feel like, well, do people think that she didn't fight hard enough, or there's an element of that. Yeah. And I do think the reason some people use that terminology is because they don't kind of know what to say. I think in Ireland we're very poor at sympathising with people or actually kind of being honest. I'd prefer people to say to me, when I was diagnosed first, some people would have said it to me and it was refreshing because I thought, yeah, that's actually exactly what it is, Jesus, Vicky, this is shit, I'm so sorry that you've got this diagnosis, but, ask about my treatment, but don't kind of say to me, oh, you're going to beat this. Do you know what I mean? Because you don't beat cancer. That's the reality. You don't.
Yeah. And nobody knows. Nobody knows what the outcome is going to be.
Absolutely not.
The time I first noticed it, I have to say, was when Kylie Minogue, and a good number of years ago, I think she developed breast cancer, and I remember all the tabloids describing her as brave Kylie, and I remember reading them at the time saying, how do they know she's brave? If I was in that situation, I'm not sure I'd be brave. I think I'd be really scared. And I just thought it was, again, I know they meant well, but I thought it was a kind of a glib term. Is that unfair? Or do you understand where I'm coming from when I say that?
No, I think it's totally fair what you're saying because I think people say things like that because it gets them off the hook, and I don't mean that in a bad way. I just think, it gives them something to say without having to actually address the reality that, this is a shit situation, you've got cancer, and nobody knows, at the end of the day. I mean, some people get diagnosed at a very early stage and they still die from cancer. So, it's a lottery, I mean, even for me, to still be alive today, I've seen so many women die from this disease over the last 2 years. And I think that's why I kind of get upset about this type of language because, any of the women I know who've died from this disease fought bloody hard to the end, but it doesn't mean that, just because they died, they didn't fight hard enough. Do you know what I mean? That I think it's not fair to the people living with the disease. And that's the way I treat my disease. I'm living with this disease, and that's what I always say. I say I'm living with cancer. I don't say I'm fighting it because you can't fight it. You've got this disease in your body and you have to learn to live with it somehow. And that's the way I deal with it. And I think if people were just more honest and kind of say to people who've been recently diagnosed, God, I'm really sorry that you've got this. And just ask about the treatment and if there's anything that they can do. And I think that would actually, people would appreciate that far more.